Hey everybody, it's your girl Frida. I know it's been a minute. Well, actually, not a minute. I told you guys that I will give you an update on what's going on with me. Last time we talked, I talked about me going to a plastic surgeon and also my bariatric surgeon. Well, when I went to the plastic surgeon, he did agree about how much. The breast reduction and not only the breast reduction. I'm so pale, you guys. Oh, that's better. I The breast reduction. He did agree that if I would like to get that done, that he can provide it, and my insurance, it shouldn't be a problem. Um, but we talked about the tummy tuck, which they call it a different word, and I forgot the word. I did my research on him. He also works in the same practice as my bariatric surgeon. So they work, kind of side by side. A lot of his patients go over to him. So, and I did my research on him, and he's pretty good. So, I asked him all of the necessary questions, and he let me know that I will be a great candidate for that. I did tell him that I wanted to lose some more weight. He did let me know of the concerns. Like some of you know, I do have panic attacks, and I take medication for that, and for my fibromyalgia, which is depression medication. And he did tell me because of the different chemicals, meaning my chemical imbalance might go off with the change of the weight, the skin being removed, and such a major operation. He did tell me about clotting. He did tell me about that scarring and problems with wound closing. And I did show him my scar, which he kind of got some of my information from the other doctors. So I showed him my scar and told him, basically it has healed pretty good on its own. So, like when I went to see my 2 week checkup, it was basically almost healed. But me, I'm the type of person that I heard so much about wound problems with people having the lap band surgery. I kept mine covered. Covered at night, and only during the day I will let it open. And but if the cats was on my bed, I will cover them up, put some ointment on it. Anyway, so I told him I healed pretty quickly from that. He looked at my scars and he was like, "Yeah." He was, but like I told him, and I don't care about the scars. Only my husband's gonna see it. And if I do decide to go, something happened between me and my husband, or God forbid anything else, happen. Um, if you don't love me for who I am, then you're not my type. Me and you can't get along. There's no reason to even go any further. So I'm not worrying about the scarring. I'd rather have scars on my body than have this extra skin. And I feel like if you going for bariatric surgery to get rid of that skin, those are just your wounds of being proud of what you've done. And I also wanted to let you know I did re-talk to the young lady, I'm sorry, she's older, the lady about her weight loss, the 20 pounds in a year. She said that was with her lap band. She lost over 100 pounds. She do credit some of the lap band, but she said when she started, it was the 20 pounds from the lap band. So now, a lot of times, you may see a lap band video, but also know, like my first 30 pounds, I want to say, no, actually the first, yeah, 30 something, yeah, 30 pounds was due to the liquid diet. Okay, and I said it in pretty videos. I did it a 2 week pre whatever you want to call it, before my surgery. I did 2 weeks after and saw foods. So if you guys do that now, believe me, you will lose just as much weight as someone who had the band. So I said that on one of my videos. Go back, look at them, and I'll tell you the same thing I'm telling you now. So my first was from that. The rest was hard work, eating what I'm supposed to eat, um, whatever. And let me quickly finish with that so I can tell you what happened with my bariatric surgeon. So he was telling me that he was examining my port area, and he said that might be an issue. He will have to get in contact with my bariatric surgeon, and they will have to work about it again. And he also told me, and when you watch it on TV, you see people getting, y'all, that's a sports where I'm showing a little too much. Um, you see people getting the breast and the stomach done at the same time, or the full body lift and the breast done. He said he does not do that. He said because there's too much skin coming off your body, it shocks your system. It's either one or the other. And he said he prefers to do the stomach area first because that's your core. And you need to really, that takes the most time to heal. Even though it's like 2 weeks, 3 weeks, you're kind of able to, sit up a little bit. That's the norm. If you have any additional problems, that takes longer to heal. But he was like, internally, it takes longer to heal than you think. So, you need those muscles to get yourself up, with the breaths, and, help yourself take care of it. If I do both at the same time, it'll shock your system. It'll be just too much. And he was like, he'd rather do one or the other. And the first thing he likes to do is the core. So I was like, wow, I asked, I had to ask that question. Well, I see all the time they get both done. And he was like, no, I don't do it. He was like, you can learn, find someone else to do both. I don't do both. My main concern is that one area. I'm not going to do both areas at the same time. I can't. He was like, because my breast, he did ask me what size I wanted to go to. And right now, I'm between, actually, I'm a double D now. I used to be a triple D. My breast have size has you know went down. Also, I used to be a 40, a size 40 around. Now I'm between a 38 and 36. It depends how the bra is cut. Also, so he asked me what size would I like to go, and I was like a D or a high D. But I'll take whatever I need to get to be healthy. So my main thing is I want to jog. I want to be able to jog without these issues. So he was like, and that's a good attitude. You're doing it. He was like, and I will put that on your insurance form. This is hindering you from continuing your weight loss. He said it would take about 6 to 8 weeks to find anything out. And I told him, he asked me, when do you want to schedule something? Think about it, or do you want to think about do you want to? He was like, because I got to give the insurance a surgery date. I said, I'm not getting anything done until my first year anniversary of my bariatric and a couple of months after that. Because a lot of you may not know, you have a set amount on your insurance. You go over that, and you're gonna have to pay for a lot of your visits on your own. Let me see. I think I'm gonna have to do 2 videos about this. So I just wanted to let you guys know that, who don't know that. So if I get my surgery with my bariatric was close to 6 to 7 thousand, and the repeated going back to the doctor's office to get filled, that's running up a lot of tab. So, and I haven't really had any issues to go to my primary care doctor, which I do have a physical coming up. So, um, you know, be aware of that. Please be aware of that. And a lot of times that's why you're denied, because you have a certain amount that you're allowed. Okay. So anyway, um, so we had a good talk. He took pictures. My husband was there the whole time. And my husband's like, oh, he's touching my girls a little too much, but he wasn't. But my husband is just funny about that. So he was just like, you're a great candidate. And I was like, well, he was like, the weight you are um is not a really concern, because once he removed a lot of the weight, I will come down even more. But he wants me to be as close as possible to my goal, so he doesn't have to redo. Now, what I told him, and I did ask him, I said, right now I can't do too much, far as jogging, far as going a little further into my workout and pushing myself a little harder. Now, I told him, I asked him, so if I was to get this done in February and I'm still continuing to lose weight, how severe would the actual, the weight coming back and probably have to do it again? He said it depends on your body. He said I cannot tell you. It totally depends on your body type and how it works. So with that, I was like, okay, that answers my question. He did tell me and show me. Well, he didn't. He showed on a picture and diagram how they would do the reduction. Um, and he did also tell me, and one of you, and please don't understand that I'm saying my insurance will pay for it. If I have a medical reason, which I do have back pain, I've always had this, it always hindered whatever, but I'm pretty sure my insurance will pay for partial of it. Most insurance do pay for a reduction. Far as the tummy tuck, I don't know until I get my paperwork back. And once I talk to my, and I'm kind of getting into that in the next video. Once I talk to the lady in my bariatric, she does both. Like she does the plastic surgery and the bariatric part of it, far as um, patient, information and talking to the insurance and, making sure the paperwork's done. And she works really, really close. She's always in the office with my bariatric surgeon. She was like, I'm going to tell you what your insurance is going to tell you. They're going to tell you have to be a year and 6 months in your weight loss before they even will consider having it. So I was like, okay, well, I can wait that long. But, other issues, which I'm going to talk on the next video about, have to be taken care of as soon as possible. So, matter of fact, I'll be calling today. But that was about it. And I liked that he was very informative. He answered every question that I had. He went even beyond, like I said, to tell me that I will have a chemical change in my body. He said you might come off this medication, or it might have to be increased. He was like, some people, it's a total shock to their body because it may not. He was like, I'm gonna tell you, I may not be able to get you a D or a C. If your body is not, um, under the fat and the breast tissue and the muscle, if it's not where he can do his little tricks, it's not going to be possible. He's going to try to give me what I want, but once you get in there, you don't know. That's what he told me, and he was very honest with that. So I was like, okay, I take that at my own risk. So he was like, he don't think it's going to be so drastic that I'm going back down to an A or B. He was like, but we'll work on that. I'm getting ready to run out of time. And he also did tell me um, that the body contouring, like say I got the flaps on the back in my stomach area, I wanted a little, well, he already said I had an hourglass figure already, so I should be perfect. But if I needed more contour, my insurance doesn't pay for that at all. I have to come out my pocket. He also told me my arms do not. Just start saving up money now. So he was like, that is not included at all. But that was it, far as going to the doctor on that, and that was Thursday. So I'm going to follow up with the next part of my video about my bariatric surgeon. So stay tuned. Like I always say, if you look good, smell good, and if you're working towards a weight loss goal, don't worry about your size, worry about a size healthy. Really worry about that BMI, which is your body mass index. Get that down. And that's what I'm focusing on so much. Is now it is 46.3. I started off at 57.7. I'm doing a great job. I want to get it down past 38, and so I'm gonna continue to work hard on that. So you guys, again, I love you guys. Thank you so much for the prayers. Talk to you later. Bye bye.